Good afternoon. My name is Dr. Christopher Meyer. I would like to thank AVLS for the opportunity to introduce you to Vein 360. As a lifelong Cincinnati Bengals fan, I'd like to thank AVLS also for moving my talk from Sunday to Saturday. However, based on last week's performance, you might have actually been doing a disservice to me.
We do what we can, Chris.
So my career as a general surgeon began over 20 years ago. And like many of you, I was eager at the time to rid the world of venous disease. Unfortunately, at that time, the only tools available were GSV stripping, SEPs, and of course, Una boots and compression stockings. The C3 through C6 patients pretty much took over my waiting room and rarely improved. I made close friendships with these patients because I saw the same people week after week, month after month with minimal improvement. The venous patient became a central challenge to running an effective surgery practice. And at that time, it felt like we were running to stand still. However, in the early 2000s, we saw a dramatic improvement in the tools available to us to treat the venous patient. Many of us, like myself, committed to specialize in treating venous and lymphatic disease on a full-time basis. And we have come a long way in the last 20 years. And, you know, with the help of great leaders like Dr. Almeida, Dr. Black, Elias, and Gasparis, we've leapt forward. And by organizing into groups like this, like the AVLS, we have leapt forward. And then with the help of industry, with breakthroughs like EVLT, RF, the retrievable IVC filters, lytics, mechanical thrombectomy, IVUS, and iliac stenting, we've leapt forward. Our specialty has innovated and our patients have definitely benefited. But leap after leap, we've improved care through collaboration and advances in technology. But each of these advances have come at a cost, namely a much higher cost. And over the last 5 years, my practice in Florida has seen supply costs increase while my reimbursements have fallen and will continue to fall. Our innovations have met with heightened scrutiny and resistance from both government and private payers. These challenges have been amplified by multi-billion-dollar medical device companies who have discouraged us from exploring more cost-effective alternatives. At a practice level and at an industry level, the playing field is definitely not level, and it's increasingly benefiting fewer, larger players. For smaller practices like my own, we must adapt in order to maintain our independence and continue to leap forward. Quite simply, my practice, like our specialty, runs the risk of being unsustainable if we do not continue to innovate. Addressing the reality of current healthcare economics and also unsustainable environmental policies requires comprehensive solutions. To this end, my wife Suzanne and I decided to fuse my experience as a vein specialist with her expertise as a biomedical engineer. Together, we created an organization called Vein 360, which was founded to create multi-pronged solutions to the challenges our specialty faces today. Our goals: number one, maintain the highest quality of care for our patients. Number two, improve the vein specialist's bottom line. Number three, optimize efficiency at a practice level. And number four, do all of this in an environmentally responsible manner. In order to ensure that our products are of the highest quality, we teamed with a world-renowned expert in medical device remanufacturing and also a world-renowned expert in medical device sterilization. These are individuals that don't just abide by the standards, but write the standards. These great minds legitimized our vision and quickly made it a reality. They helped us to build a diverse interdisciplinary team of engineers, industry experts, and physicians to rapidly deliver remanufacturing solutions for many of the devices that we use every day. We made our first contribution to the vein world in late 2019 with the introduction of our remanufactured RF catheter. This product has already been a tremendous success for our company. But the goal was never to be just a medical device remanufacturing company. It has always been to see problems and challenges at the level of the vein specialist and solve them. Whether it is converting a laser customer to RF or customizing a procedure pack to eliminate waste, we are constantly communicating and collaborating with vein centers throughout the country and working with them to offer customized solutions. The final tenet of the Vein 360 mission is to operate in an environmentally responsible manner. Not only can we create significant supply chain savings through safe, efficient, and FDA-approved reprocessing, but we are also preventing these materials from becoming landfill waste. To date, our remanufacturing operation has captured over 30,000 radiofrequency ablation catheters from becoming landfill waste. And within the next year, we expect to double this amount. Through our partnerships, we are able to aid vein centers in converting all of their waste into a clean energy fuel source and completely eliminate their biohazard landfill accumulation. Also, we have created state-of-the-art technology that gives us complete traceability of every device we produce. We have engaged hundreds of practices just like mine and have generated millions of dollars in supply chain savings for our customers. Lowering costs and eliminating waste are central tenets to Vein 360's manufacturing operations. When we combine this with improving efficiency at a practice level, we help our specialty leap forward once again. At the end of the day, we're all in this together. As physicians, engineers, as patients, and as members of a community, we all have a role to play in moving our specialty forward. Vein 360 has several new solutions in the pipeline to ensure that our patients receive the best possible care at the lowest possible price, all with a minimal impact on the environment. Thank you to AVLS for the opportunity to share my vision with you today. And I encourage you to visit our booth and request a free sample and begin a dialogue on how we can help you continue to thrive and leap forward.